The Ministry of Health has taken a significant step towards improving the country's healthcare system by distributing new medical equipment to health facilities and redeploying doctors to underserved areas. During a visit by Honorable Kwabena Akandoh, Minister for Health, to the University of Ghana Medical Center and the Korle Bu Teaching Hospital to present anesthesia machines and engage with leadership, he disclosed that government has begun distributing 50 anesthesia machines to health facilities across the country, with the first tranche of 8 machines going to the Korle Bu Teaching Hospital and 3 to the University of Ghana Medical Center. This initiative is part of a longer effort to ensure that health facilities have the necessary equipment to provide quality healthcare services, Honorable Mintah indicated. The minister has also announced plans to redeploy over 700 medical doctors to district hospitals and other underserved areas. The aim is to ensure that medical doctors are distributed equitably across the country, with 80% of them expecting to be posted to district hospitals. The government is also working with the private sector to ensure that health facilities have the necessary equipment and personnel to provide quality healthcare services. This partnership will help to bridge the gap in healthcare delivery and ensure that health facilities are equipped to handle various medical emergencies, he noted. Honorable Mintah Akandoh addressed concerns about the potential impact of the presidential directive on the retirement of public servants on the healthcare sector. He assured that exceptions would be made for critical staff, allowing them to continue working beyond the age of 60 if necessary.
Yeah, so every health facility and the kind of equipment they need. So you cannot go and put an anesthesia machine at the CHIP compound. It is useless. And so government has taken the decision to retool our health facilities, number one. This is just the beginning. We have 50 anesthesia machines. Korle Bu, because of the enormity of work they do, we are giving them 8 out of the 50. This is the first tranche, and we'll make sure that what we have for now will be evenly distributed per the needs of the facilities we have in this country. And we've also requested that they take very good care of it. Government is not going to do the retooling alone. We're going to include the private sector. PPP is part of the retooling. Now we are working on dialysis machines. From there, we'll go to the next point. So the private sector will be our partners to make sure that every health facility in this country has a required number of machines or personnel to be able to execute their work very, very, very well. And I made mention of the posting of our medical doctors. It is true that about half of the medical doctors we have in this country are in Accra, and to be specific, Greater Accra. And obviously, everybody would understand that it doesn't, it is not equitable when it comes to the distribution. And so there's the need for us to reset that particular distribution. And so we have the opportunity to distribute more than 700 medical doctors, and we think that about 80% of them should go to the districts. And of course, we have to put certain measures in place to be able to encourage and incentivize those who accept postings to those who are. And one of them will be the number of years you spend at a district to get the opportunity to come and do your fellowship, right? Your specialty. And so if it is, for example, if you must serve in Accra for 4 years before you are given the opportunity to do your specialty or to become a specialist, maybe if you spend 2 years in the district, you should be able to get that opportunity to come and do so. So there are some incentives package we are putting together to encourage our wonderful medical doctors to give off their. So he raised the point that there are some critical needs. And so, you see, there is a presidential directive that people who have attained the age of 60, we should not renew their contract, so that it will give way for the young ones to also fill those gaps. But of course, to every law, there is an exception. If we have a critical need, we can make a case and then we'll look at it. teaching must follow this presentation. I thank you so very much.
Thank you so much, Mr. Minister. We are honored.
Treasure.
Top notch. That's creme de la creme.
It's a top-notch brand.
Top notch.